In 1904, 2 Americans in 1,000 were in mental hospitals. By 1955, 4 in 1,000 were institutionalized. Psychiatrists argued whether it was a result of biology or experience, but there was nothing to help the chronically mentally ill. They were usually warehoused in state institutions. The current psychiatric hospital inpatient population is only 5% of what it was at its height. Some of this deinstitutionalization comes from the availability of medication and improved outpatient treatment, but many have argued that the closing of hospitals simply resulted in a shift from psychiatric institutions to prisons. Before drug treatments, there were no viable methods for treating symptoms of schizophrenia. The treatments ranged from hydrotherapy to convulsive therapy, all ultimately trying to stimulate or subdue the activity of the nervous system. Even within recent history, patients were subjected to desperate and generally unsuccessful attempts to treat the condition. The potential for chlorpromazine to affect mental state was identified in 1952 by a French surgeon who was exploring drugs that might reduce the level of surgical anesthetic. There was some initial resistance to the introduction of this antipsychotic drug in the US due to the prevailing psychoanalytic and behaviorist traditions, but the overflowing state institutions took notice, and a new era of psychopharmacological treatment was born. In 1954, chlorpromazine, marketed in the US as Thorazine, was approved by the FDA, and it took the country by storm. It had a calming effect without sedating patients, allowing them to live a nearly normal life. By 1964, some 50 million people around the world had taken the drug. Similar antipsychotics, such as haloperidol, were soon introduced. As people later discovered, these are not wonder drugs and carry a high risk of side effects. The drugs work by blocking dopamine, but can cause a condition called tardive dyskinesia in about 50% of patients that involves tremors and involuntary movements, a condition that may continue beyond the discontinuation of the drug. It seems that extended use, extended blocking of the dopamine receptors, leads to an upregulation of these receptors in certain parts of the brain related to movement, leading to these movement symptoms frequently seen in Parkinson's disease. Second-generation antipsychotics, also known as atypical antipsychotics, include clozapine, risperidone, aripiprazole, known as Abilify. These newer drugs have less effect on dopamine, but stimulate serotonin receptors and increase glutamate release. Atypical antipsychotics can still produce tardive dyskinesia, but at a much lower percentage. However, they also have some additional side effects, such as weight gain and immune system impairment. I'll end by mentioning a somewhat controversial approach to treating schizophrenia, treating the condition before it becomes fully manifest. Such early diagnosis and treatment approaches argue that it's important to correct the trajectory of schizophrenia by recognizing and treating psychosis in its early stages, also known as the prodromal stage. Prodromal is derived from the Greek word prodromos, meaning forerunner of an event. Prodromal symptoms are identical to or similar to the symptoms of schizophrenia, but are not as intense or as long-lasting to meet the standard criteria for diagnosis. Treatment involves a combination of drug therapy and cognitive behavioral therapy. However, it can be particularly difficult to diagnose schizophrenia in teens, the age at which many symptoms may arise. This is because the first signs can include a change of friends, a drop in grades, sleep problems, and irritability, behaviors that are common in teenagers. While there are obvious benefits to being able to treat individuals before schizophrenia has fully taken hold, the risk of false positives, of incorrectly labeling teenagers and treating them with drugs, creates an ethical dilemma. Perhaps a less drastic treatment approach might be possible. In a recent study, 12 weeks of fish oil pills made teens at high risk of psychosis much less likely to become psychotic. A year after entering the study, 11 of the 40 teens treated with placebo pills developed a psychotic disorder. But this only occurred in 2 of the 41 teens who had taken omega-3 capsules.